patient hit a step walking up the stairs, missed a step, and then hit the front of his toe on the step. He tore some of the skin, which then proceeded to hit the nail, which tore the nail off as well. So he did see it lifted, not all the way, but he saw the toenail was lifted. So the mindset on why I have to remove this is that I do not want to have an infection occur. So with the past history of diabetes, I want to limit the amount of infection that can happen. So if this nail was avulsed and bacteria got underneath the nail, then I know there's a risk of infection. So nail has to go, I have to clean out the area, and then he'll be fine and good to go. Nail will grow back in 6 to 12 months. It takes forever. It takes about half the speed of a fingernail to grow out of a full toenail. But nonetheless, at least we can prevent infection while he's healing. Very good. So let's do it. Let me know if anything's uncomfortable, okay? Again, I just free up this skin around the nail just to make it as least traumatic as possible. Everything should just come off nicely. He's obviously not feeling anything, so that's good. All right. He's already on an oral antibiotic, so I'm not worried about that. There we go. It's a boy. There. Everything looks nice and clean. But you can see here at the tip, since the when did this happen? Saturday. So the body's been trying to heal this, and it's been leaking fluid. So all this tissue right here is getting macerated. Well, when that stays wet for a long period of time, the likelihood of infection is high. So I'm glad we did what we did. So now I'm just going to dress him up nice, put some betadine ointment on there so it dries it out. It's that brown, kind of like what we have to prep the toe. We're going to put that right on top of the wound itself and on the surrounding skin so it doesn't get too wet. Then we're going to apply the crucial dressing, which everybody should know about this by now, but the Adaptic. This thing right here is a petrolatum gauze so that it doesn't stick to his skin. So when he takes the dressing off, when he's at home, he's not in excruciating pain, because that's one of the worst things you could do is put a piece of dry gauze on that wound and then rip it off later at home. It does not feel good. So Adaptic, or a non-adherent gauze on this wound, will be a nice thing for the patient when he goes home. Alrighty, so that's it, and we'll see you next time. Thanks.